Okay. All right. So welcome to the State Loan Repayment Program. And I'm welcoming everyone here as well as administrators. And I believe everyone here is interested or will be working as site administrators this year for your employers or your providers. So I just want to lead with a quick thank you for being part of our program and taking on the role of site administrator for your employer to participate in the SLRP. We understand that site administrators play a huge and important role in connecting service sites and providers to the SLRP, so we do appreciate your assistance in supporting the program and keeping it running smoothly. As site administrators, you will be working closely with our staff, also known as the Primary Care Office or the PCO, in the portal to communicate eligibility of your sites and details of provider applicants that are interested in applying during the year, or even participants that are already within the program as well. And you'll also be working closely with your own providers to assist them in verifying their employment and fulfilling obligation monitoring requirements. Typically, each year, there's an initial cycle for providers that are accepted to the program, and they start with an initial 2-year commitment. And then each year after the 2 years, they can renew for another year. So site administrators will be responsible for helping through those obligation requirements for those providers throughout each of those contract years. So here are a few of the key responsibilities for site administrators. These vary in different ways of whether or not the provider is in need of these items for their applications or for verifying eligibility of employment or for service sites. So I'll go over the list right now. So some of the responsibilities for site administrators include maintaining sites and providers in the PCO portal. And we'll get into a lot about the portal during this presentation. Then you can update the site registration each calendar year during an open site registration, which is typically through January through March. So currently the site registration cycle is open for the year of 2024. So if you're interested in registering sites or adding new sites, then you will have that opportunity to do so during this calendar year until March 31st. And that date has been extended. So it was February 31st or 30th, but we have extended it to March 31st. Additionally, you will be able to enter and upload site-specific documents in the PCO portal for completing site registration. You'll verify each provider applicant's employment and other additional eligibility requirements, such as the employment start date, service hours, whether they're full-time or half-time, and so on. And then you will upload required and supplemental documents that may be requested by the ADHS for provider applications. You will be the provider applicant's point of contact for their service sites, and you will also be ADHS's key contact person for any site-specific questions during the application process. Additionally, you'll also be the key contact person for any questions related to provider applicants or participants employed at your sites. So these are just an overall look at what you'll be working with in the portal as well as during the provider obligations. So there are a few primary processes we'll be going over today in this training. We'll be going step by step on each of these processes, and then we'll take you through an additional process that will be optional depending on your situation. So we'll be going over creating a site administrator account if you don't have one currently, and then registering and activating eligible service sites.
Do me a favor, email Madison Luna.
1 second. I think we need to ensure that everyone's muted for the call. All right, thank you so much. And then for the third responsibility, you will have to help with employer verification for provider applications, which include for initial, renewal, and request for change applications. And then finally, you will help with entering and submitting provider quarterly encounter reports throughout each quarter of the year. So we'll go into more detail about all these processes throughout the presentation. And then the additional process is to transfer the site administrator role to a different account if it is needed. There are situations where an active administrator account must be transferred to a different point of contact. So we'll go through that process towards the end. So for the first primary process we'll go over is creating a new site administrator account. All site administrator tasks can be accessed through the portal. So the PCO portal is the main hub for site registrations, provider applications, and provider obligation monitoring. Any new site administrators must create a site administrator account to manage service sites and providers participating in the SLRP. So step one of creating a site administrator account is to access the PCO portal, which is can be followed by using this link. Step two is to create a new account by clicking no account and create one towards the bottom. And then it will be indicated on the screen with the red arrow. Step three is to select the site administrators button to create a new site administrator account on the rightmost side of the screen. And then step four is to complete the required fields on the next page and select register when you're finished. And then when you're going over these fields, you'll notice that you'll have to select your employer name from the drop-down selection. You'll have to enter your first and last name, your phone number, and your email address, and register a password as well. The email address and the password will be used for logging in, so make sure that you have that kept on record somewhere for you to refer back to. Once all of that is completed, you'll select the register button at the bottom. So step five is you'll receive a confirmation email that will be sent to the email address registered to the account. You'll have to click the link in the email to verify that account. And then sometimes these emails may be marked as spam. So please be sure to check that folder if you did not receive that email. Step six is to enter the email address and password you registered with back on the login page. And then once you have logged in, you'll be met with the account overview or landing page. Each step on the landing page is a different process. So step one contains your employer information with the account, which the account is registered with. Step two is the number of sites currently registered under the employer. Sites here can be added or edited in this step. And then step three is the number of pending employment verifications needed to be accepted by you as the site administrator. Step four is the number of approved provider requests that are requiring additional verification. And step five is the number of fully verified provider applications. So once you go through each step, it'll be different processes for each part of the provider application or for site registration. We'll be going over each of these steps individually throughout the training process today. So for steps 1 through 2 on the landing page, this is where you'll be able to register service sites to participate in the State Loan Repayment Program. It will fall under these steps on the PCO Portal landing page. So be sure that if you are needing to go back into the portal to register, you'll have to visit steps 1 and 2. For your provider applicants to be eligible to apply for the State Loan Repayment Program, your site must be registered and active prior to the provider application cycle. So application cycles typically are in mid-April. If they are renewing, they'll be renewing in April as well for a third year at least. And then before registering, you must ensure that your service sites meet the SLRP eligibility requirements that are found on our website, and they can also be found in our site reference guide. But I linked it here on our website if you'd like to refer to that. And I'll be sending out this PowerPoint after this presentation as well, so that you can click on the links. So here are some of our qualifications for becoming a SLRP service site. To qualify for participation, all sites must meet the following eligibility requirements that are listed here. I won't go over them into too much detail, but if you have any other questions on these, you will be able to ask us towards the end of this presentation, or you may email us at our email that we'll provide at the end as well. But these requirements are also outlined on our website and in our site reference guide. So please be sure to look into that when you have the time. Please note that free clinics or federal or state prisons may be exempt from accepting certain health plans, such as Access and Medicare. Indian Health Service facilities, free clinics, or federal or state prisons are exempt from implementing a sliding fee schedule. So those are just the few exemptions that we make for these eligibility requirements. But all other site types must meet the requirements that are listed here. There's no other exemptions that we can make other than those facilities that I've listed. So to start with registering your sites, you will need to click on step 1 on the landing page of your homepage, and you'll find the employer information screen. Here, this is where you'll enter all the information and contact info for your employer specifically. All fields in the section are required to be filled before you can click submit to save the employer information. And then once you're finished with that, you can also return back to the home page by clicking the top left logo at any time to return to that page. Step 2, back on the landing page, you'll have to click that to access the sites page for your employer. On this page, you may need to add new sites or edit existing ones during an open site registration cycle. There is no limit to the number of sites that you can be registered. As long as they are able to be eligible, that is all that matters for the site registration. Keep in mind that if you don't see any sites listed on this page at the moment, there may be no sites that have been registered under your employer, so you will need to add a new site. And the status of each site can be found under the status column. So if the status is active, the site has been successfully registered before or has been already. And then if the status is inactive, the registration for the site has not been completed or needs to be reactivated if it was previously registered. And just to note here that if the status is still inactive during a provider application cycle, the provider will not be able to apply for that site. It will have to be activated in order for the provider to complete an application for that specific site. To add a new site, you'll click on the Add a New Site button, and it'll take you to the site's information page. You must fill in all these fields that are listed here. I believe there are 3 different sections where you'll have to answer yes to each of those sections. That is including the Medicare, access, and qualifying health plan sections. If you're answering no for any of these, your site will be ineligible to participate in the SLRP. So you must answer yes for these questions. After you click yes, you'll have to enter the site access and Medicare ID number where it is indicated. And then for marketplace insurance, you must enter the name and number of the plan where it is also indicated there. For the following fields, the system will not allow a no answer for the sliding fee schedule. So you will need to answer yes for this unless you are an IHS facility, a free clinic, or a state or federal prison. So all of these clinics or sites will need to be registered as yes for the SFS requirement, as long as you're not any of those that are listed here. And then the system will also pre-populate the census tract number towards the bottom of the page. So it will be based on the address that you entered previously for the site. If you do not see any census tract number listed here, that means you will need to find it using the step-by-step instructions that are linked on the page, and that will be used to obtain the site's census tract. So continuing on with the page as well, there will be places for you to enter your HPSA and undeserved population data. For the data entered in this section, they will be used for scoring applications. So any data that you list here, there will be a point system associated with what kind of data you enter into this part of the page. To select the service category or categories that are applicable to your site, you'll have to select from the 3 categories that are listed here. So you'll be able to select whether or not this site provides behavioral health, dental services, or medical services. And then you'll have to report the data for all of the categories that are selected once you select those pieces of the page. So to enter that data, you'll have to enter the HPSA ID number and the HPSA name for each of those types of services that you listed from above. And then once those HPSA ID names and numbers are entered, you'll be able to enter encounters for the last 2 calendar years in the data table that is listed below. If there are no encounters to report during the last 2 years, or you have not been in operation during those 2 years, you will be able to enter 0 for these categories. And then in the following page after that, you will be able to provide an explanation if you were not able to provide data for the past 2 years or if it was unavailable for you. And then at the end of the page, there'll be a designation for AZMUAs, or medically underserved areas or populations. And this is required only if the service site is a rural for-profit private practice and they are not located in a HPSA. So the HPSA designations usually come first, and then if there are no HPSA designations for a rule of for-profit private practice, then you will enter the AZMUA name. Once that is all completed, you'll be able to hit save and continue to the next page of the site registration. In the following page, you'll see that there are a drop files here section. So each section of the file upload will be for different documents that are required to be uploaded per site. And each of these sections must be filled in order for the site to be activated. So you will have to upload sliding fee scale policies, sliding fee scale tables based on the current FPL guidelines, and then the sliding fee scale signage. And then any other site-specific files that are in the other section. So, for example, you may upload your evidence of your HPSA here, or any other documentation that will help with verifying that your site is eligible. Once you've uploaded all of your files, you'll be able to see that they are listed on the following page, and it'll show the name of the PDF file names or whatever file that you use to upload the documents. Once you have verified that the documents have been uploaded, you'll be able to continue to see if the site has been activated at this point, and they'll be ready for provider applications. This process will need to be repeated for every service site that you wish to enter. So please be sure that you are uploading documentation for all of the sites that you have listed under your employer if you would like to activate it for the year. For steps 3 through 4 on the landing page, this will be for provider application verifications. And these are for all initial renewal and request for change provider applications. Providers must receive the employer verification and validation of their employment to complete and submit an application for the program. So there are several application cycles that you'll have to anticipate during the year. Initial applications usually start between mid-April through June 1st. April renewals start from March through April 1st, and then October renewals start from September through October 1st. And then any requests for change for obligated providers will start anytime during the provider obligation. So these can be submitted at any time during their contract. So to provide provider application verification, you'll start on step 3 on the landing page. And this is where you'll see the pending request section. The site administrator can view all the provider requests from this list for employment verification that the provider has submitted. You can either approve or reject the request depending on whether or not you verify that they are a provider under your site. If they are not your provider, or if they selected a wrong site that is listed in this section, then you'll have to reject that request and request for them to reselect their verification so that they can send that request to you. And then after that page, you may be able to see multiple of those provider requests on the same list. So you'll be able to check off boxes for each of the requests that are needing to be approved. And then once you select all the boxes that for the requests that you would like to approve, you can hit approve at the top of the page. You must verify that the provider and the site name are correct before approving, as you'll be forced to go into the next step so that you can help with the request for the provider. So back on the landing page, you must go to step 4 in order to complete this process. Please note that these are 2 different steps, but they will have to be done in order for the request to be completely fulfilled. So you must go from step 3 to step 4 after approving each of those provider requests. The requests shown on step 4 are accepted requests from step 3 and have not been fully verified, so they will still be in pending status, and they will show as incomplete on the provider's end as well until you fulfill the status for those requests. So once you view those requests, you'll be able to enter each of those requests by clicking on the request ID to access the file. Upon accessing the file, you'll be able to see the provider information page, which is specific to the provider's request. You'll be able to complete all applicable sections of the page, and then you'll hit submit after filling each of those sections out. Once you complete those fields, you'll be brought to the certification and authorization page, and you must check each of the boxes to certify compliance of the service site to the eligibility requirements of the SLRP and the initial consent to release information. You'll have to provide your initials towards the bottom of the page as well for each of those certifications, and then you'll click Save and Continue when it is complete. On the next page, you'll see that there are fields for uploading and entering the employer service site information form. And this is available as a template for you to download first so that you can complete, sign, and notarize it towards the end of the form. So before you download it, you will have to ensure that the information of the provider is correct on the SE form. So once that is correct, you'll download the template, verify that all fields are correct, and complete the fields that are needing to be entered. And then you'll print the form to sign and notarize the last page, which is where you'll need to ensure that the physical form is entered, signed, and notarized. And then once the physical form is scanned, after being completed, signed, and notarized at the end, you'll have to upload it to the portal by clicking Choose File and then Upload. And then you'll click Submit at the bottom right to complete the verification. After clicking Submit, you'll have a pop-up message that comes up to confirm that the process has been completed. You'll select OK to be redirected back to the landing page. In step 5 of the landing page, you'll have to verify that you completed the verification for the provider that you were able to upload the SE form for. So once you go back to the landing page, you'll click on step 5, and then all completed requests will be displayed in that list. The provider will then be responsible for completing and submitting their application once their verification process has been completed. Otherwise, they are not complete with the application until it is submitted from their side. Requests for change may be submitted by an obligated provider at any time during their obligation. Some changes that require employer verification from the site administrator include changes in employer or service site, adding service sites to existing approved sites, changing in service hours from full-time to half-time, and so on. The required supporting documentation for each of these changes includes the SE form and a fully executed employer contract or employer letter that certifies details of the provider's employment, such as service site names, site addresses, and provider hours per week. And these are necessary for the request for change to be approved for the provider. Quarterly encounter report submissions are part of the provider's obligation monitoring process and are required to be submitted after each quarter of service with the site administrator. Each encounter form must be entered in the PCO portal, signed, and notarized. On this slide, we have outlined the time frame for each quarter of service during the year. In total, there should be 4 quarterly encounter reports due per year. So for quarter 1, that's from January 1st through March 31st. Quarter 2 is April 1st through June 30th. Quarter 3 is July 1st through September 30th, and quarter 4 is October 1st through December 31st. Each encounter report will be due by the 10th business day of the following month after each quarter of service. So for example, the quarter 1 encounter report will be due on the 10th business day of April, and so on. To access the quarterly encounter reports, you will have to go back to the landing page to see step 6, which is under the encounter information column. Click step 6 to access any submitted or pending encounter reports for your providers. To view the quarterly encounter forms, you'll have to select the appropriate year and quarter for each of the encounter forms you are trying to enter, and you will have to select pending status to see the encounter reports that need to be completed. Once you select all of these filters, you'll be able to click search, and then a list will pop up towards the bottom. Please note that encounter report submissions will be open after each quarter of service. So before the service quarter ends, you will not be able to submit the encounter report until it has ended already. So that will be the time frame for submitting encounter reports. So once you click search, the list of providers will be shown at the bottom of the page. You may filter each of those encounter reports by provider name, year, quarter start date, and quarter end date. The bottom left shows the number of encounter reports that are needed to be completed at that time. And then you will have to go through each of the pages on the bottom right to see all the encounter reports if there are multiple pages. Once you enter an encounter form or click edit on one of the provider names, you'll be able to access the encounter report for the provider you would like to enter the encounters for each site. The site encounters will be added by clicking the Add Site Encounters button to add a section for each encounter information for that specific site. After clicking the Add Site Encounters button, the site's information table will appear, and this is where you'll enter encounter data for the site. And if you'd like to enter multiple sites, you will be able to select that button again, but I'll go into that a little bit more later. So the required fields for each of these encounters will be for the site name, the employment type, the total encounters, and the sliding fee scale encounters. Only registered sites that you were able to register in steps 1 through 2 will appear in the drop-down selection here. And then employment type is based on whether the provider is serving full-time, which is minimum 40 hours per week, or part-time, which is minimum 20 hours per week for their employment. And then you'll have to enter the number of total encounters and then sliding fee scale encounters in the top right fields. And all 3 of these will be required. And then, oops, I think I duplicated this slide, so I'll skip through this. So once the site encounter information has been entered, you may continue by adding additional sites using the Add Site Encounters button that I mentioned previously. Otherwise, you can click Save to finish entering encounters. If the provider has multiple sites, you'll need to create the additional sites information table by clicking Add Site Encounters, and this will allow you to enter in another site that is different from the site that you entered previously. And then you'll have to repeat these steps for each site that you would like to add or that you'd like to enter for the provider. Once all the sites and encounters have been entered for the provider, you'll have to click the green Save button towards the bottom of the page, and then a pop-up message will appear confirming that this encounter form has been saved successfully, and if you'd like to download the encounter form or upload it to the same submission box. So you have to click OK to proceed with those steps. Once you click OK, you'll see that there are additional sections that are appeared at the bottom of the page. The first section is a statement that when checked will certify that the provider has only worked at the sites entered above. Once the checkbox is marked, proceed with clicking the Download Encounter to download the encounter form template. And that is going to be the purple button that is displayed at the bottom of the page. Once the downloaded file is downloaded, then you'll have to open it to view the physical encounter report. The top section of the report will be pre-populated with the information entered from the portal. So you'll have to verify if that information looks accurate from the portal to what is entered on the physical encounter form. And then the bottom section is where the provider and the executive director or site administrator or authorized representative will sign, date, and notarize the form. So there are 2 different sections that will need to be signed and notarized by the people responsible in the highlighted areas. And then once the signed and notarized form is completed, you'll have to be able to submit that into the encounter report portal side of the submission box. But for the PDF file, you have to print it in order to get both of the sections signed and notarized. After the encounter report is fully signed and notarized, you'll scan and complete the document and upload the file back into the portal where you first downloaded the encounter form. So you'll have to click on Choose File under Upload Files and be sure to upload the document as a PDF file. We recommend that a PDF file be used since it will help with formatting and ensuring that that everything that is listed on the document looks accurate and cannot be changed. And then for the next section that is under that upload file, you'll see that there is a vacation requested section, and this will be before the Save button. It appears differently in the screenshot, so you'll have to make sure that you fill out the vacation requested section before saving anything. So this section is to report any vacation taken by the provider during the quarter. So vacation counts as any leave taken during the quarter that is no more than 7 weeks or 35 days per year. So you'll select yes or no according to that, and then proceed with finishing the report by hitting Save. After hitting save, a pop-up message will appear confirming that you'd like to continue, as no further changes can be made once the encounter form is saved. So you'll have to click OK to submit the encounter form, and another pop-up message will appear confirming that the form has been submitted. You'll have to click Continue to return to the encounter's search page. Back on the search page, you may verify if the encounter was successfully submitted by searching for encounters in the completed status. So you have to hit search, and the list will provide all encounters that have been submitted at this point. They will show as active under the status column at the right side of the page. And then you'll need to repeat all the steps for each provider obligated under your employer, and that will conclude the process of entering and submitting your quarterly encounter reports. For the optional process, you'll be able to have an active site administrator transfer the site administrator role if it is necessary for a new account or a different point of contact to be added as a site administrator. And this can be requested through the PCO portal. Please note that the portal is only able to allow one site administrator account per employer. So if you do have multiple site administrators that are handling processes in the portal, it is suggested that you make a shared account between all of the responsible site administrators so that it will meet the limitations of one account per employer. So to start with the site administrator transfer, you'll need to create a new account if you are needing to create the account. And you'll do that by visiting the PCO Portal login page, which is linked here. Then you'll have to click No Account and create one. And then step 2 is to choose the site administrator's button to create a site administrator account on the right-hand side of the page. Step 3 is to select your employer name from the drop-down and fill in all fields. Once that is completed, you'll have to click Register in order to complete the fields there. After hitting register, step 4 will be to find the confirmation email that was sent to the email that was registered with the account. Then you'll have to click the link in the email to confirm and log into the PCO portal. Step 5 is that you'll be logging into the landing page, and a pop-up message will appear that will verify if you'd like to transfer the site administrator responsibilities to the account if there is an existing site administrator for that employer already. If you'd like to transfer, you can click yes. But if you do not want to transfer and it is actually a new site that you are wanting to be a site administrator for, then you'll have to click no, this is a new site. If you have clicked yes in the previous step, then the next step will be for a new screen to transfer the site administrator role. In this screen, you'll have to select the name of this former site administrator and any notes for the reason of the transfer. Then you'll have to click submit to send the transfer request to the PCO. We'll receive the request on our end, and we'll need to approve the request to complete the transfer. And then an email notification will be sent to you once it is approved. So that will complete the site administrator transfer process. And then there's an additional retention survey that is going to be separate from the PCO portal, but you will receive it through email. This is from the Practice Sites Collaborative, or PRISM. And every obligated provider and their site administrator will eventually receive this during their obligations. So this survey system is a multi-state collaborative to study retention and are distributed to all providers serving in either the SLRP or the NHSC Loan Repayment Program. There are 3 provider surveys that are given in the beginning, middle, and end of their contract, and then site administrators will receive these surveys at the middle and end of each of their providers' contracts to report feedback on the program. For more information on these surveys, you can visit the link that is listed here on this slide. All the information from this presentation and training is outlined on our website, so you may visit the link here at any time to get more details on the program or to retrieve any resources such as the site reference guide that was mentioned during this training. We'll be updating the site reference guide later, hopefully soon, so be sure to look out for that, and we'll be able to link that on the website as well. If at any time you have any questions or concerns regarding your service sites or providers, you may refer to our centralized email address, which is workforce@azdhs.gov. I will be your primary SLRP contact, so you may contact me through the workforce email or directly contact me by phone, which is listed here for you as well. And then Edith DeSanto, who is our primary care office chief, will be the secondary contact in case you are unable to reach me. but please contact me first as priority. And that concludes our training session for today for all of the site administrator responsibilities and key roles that you'll play in the PCO portal. If you have any questions, we can answer them now, or we can take questions in the chat as long as we are able to have some time for now. I think we have about 20 minutes. All right, thank you so much.
Thank you.
Thank you. So it looks like we have one question in the chat. Can a site or organization have more than one site administrator? So it is not possible for the PCO portal to hold more than one site administrator account. However, if you do have site administrators that do multiple processes in the portal, we suggest that you make a shared account between each of your site administrators so that you're able to use that one account together. I believe it's possible to access the portal from multiple places. You'll just have to be under one account. Another question is, if a site administrator is no longer at the site, can the role be transferred without their involvement? Yes, so you do have the ability to transfer the site administrator account by creating a new account. Once the new account is created, I believe you'll be able to request for the transfer without the other site administrator needing to do anything. It'll just have to be, oh, sorry, I'm going too far. It'll just have to be approved by the PCO first before the transfer can happen. So you'll be able to request it without the other site administrator.
Yeah, the one thing to note about that is if you have to request to be transferred to the sites right when you create your account. You can't create an account and then start creating new sites and then request a different one. That will have to be done via email, and then we'll have to have our IT connect you to the old site. So it has to be done right when you create your new account for the transfer to work.
All right. And then for the next question, it says, how long does it typically take to approve a new site? So the portal actually will be able to activate your site for you once all of the registration process is completed. So there won't be any approval needed from us particularly, but the portal will be able to activate the site automatically once it has shown that you completed the registration process. I think activating the sites requires that you upload supporting documentation for each of your sites. So that is the essential part of activating the sites. So once you get to this page on the site registration, you'll have to drop your files into here, and you'll have to make sure that all the files are uploaded before the site can be shown as active.
And our office does a thorough review of all the site documents during the review of the applications from the SLRP providers.
And then the next question is, what should we do if a SLRP provider is no longer employed with our organization? So there are ways for the provider to transfer their obligation to another organization that's eligible for the program. We would have to be notified about that within, I forget how many days it is within the time frame.
Yeah, so typically we request that we be notified, 30 days before the transfer or the separation of the employee happens. But if you find that you're still being requested encounter reports or service verification, that was something that you would want to reach out to our office immediately so that we can kind of follow up and work with that provider to make sure they've submitted their change. So if they're still showing up on your account, it's still on our end, they're still showing, and we ask that you send us any notification as soon as possible so that we can work with the provider to ensure they're not being tied to your site any longer.
All right. And then the next question is, I don't know if I missed this, but is there a limit on providers that can participate at a site in the SLRP?
Do you want me to answer that? I can go
Yeah.
ahead. So per the rules right now, there is a limit on how many applications we can accept during the initial cycle, which is the mid-April through June 1st cycle. So in that cycle, the rules say that we can only accept 4 maximum per employer. And so if that employer has multiple sites, they can only have total for the employer. So sometimes we find that, like with organizations like federally qualified health centers or things like that, they have multiple locations. So if they have providers applying for multiple locations, only 4 total can be accepted during one cycle. And then it's 2 per site. So if there's more than 2 providers per site, then only 2 can be accepted during the initial cycle. And then after the initial cycle, if there's funding still available, we will open up an October or September through October cycle, where those applicants who applied during the initial cycle and didn't get funded because of the site restrictions, then they can reapply, using their same application and just submitting again. And then during that cycle, we don't have a limit on how many we can approve. So sometimes providers are limited during that initial cycle, just to make sure that we're trying to get as many providers from all over the state and as many sites as possible. But if we have additional funding, we'll open another cycle. And at that point, it's not limited. And so if, an employer had 4 the year before, for the prior year, there's not like a limit, like you already have 4 people on, no one can apply. It's per application cycle, how many we can accept in that initial cycle only. There's only a limit there. So it's not so restrictive that we can't accept multiple providers from an employer or site, but only during that initial cycle is when we do restrict that.
All right, thank you for answering. And then the next question asks if you can start the registration process and finish it later if you need to gather additional information. Yes, I believe you can start the process without completing it, but just ensure that you are completing the entire registration process. So getting to the uploading of the documentation at the end before the site registration cycle closes. So for this year, the cycle will be from January through March 31st. So until March 31st, you'll have the ability to complete your registration for your sites. But after that, I believe it will be closed and you'll not be able to go back into the registration to activate your sites. All right. That looks like the end of the questions in the chat. Is there anyone else that has any other questions that we can answer for now? Or if you'd like, you can email us at our centralized email. I'll list it here on the slide. Oops. It'll be the workforce@azdhs.gov email if you'd like to send us another question later on.
We got one more, Tiffany. It says, will the site reactivation interfere with active SLRP recipients? It won't interfere with their, obligation, but we do encourage that you keep those sites active and make sure you are activating them each year because if they have to submit a change application, or if they're eligible for a 3rd-year renewal or any kind of renewal after that, then they wouldn't be able to do that. So we do want to make sure that all sites, even if you don't have anybody that's planning to apply, all sites that do have SLRP participants are active each and reactivated each year. It's also a great recruitment and retention tool. So, being an active SLRP site could, and we hope it's a recruitment tool that you can say that the site is active and you would be eligible through our site to be part of these programs. So it's always a good idea to have it. We are working with our GIS team to get a map of all the sites that are, active, updated, so that, people who are coming to Arizona and are interested in SLRP can search for it, because right now that's not possible, but we're working on getting that. So hopefully once that gets uploaded, you would have that kind of recruitment tool for your organization. And then there's another question: do employees that have been with us have a higher priority over newly hired employees? Actually, the opposite is true. And I'm going to try to pull up the rules really quickly, but we do give additional points for newly employed staff. So if they've been employed within 1 year of the application submission date, they get an additional 4 points or something like that. So it's actually the opposite. It's if they're newly employed, they get additional points.
All right, seems like there are no other questions for now. Let's wait a little bit more until. All right. Yeah, we'll be able to take any more questions over email, or you can call us at any time. Call me first on the primary PCO contact information page, and I'll be able to assist you at any time. If you have any other questions, you can forward them to the email as well. But for now, the training session is completed for today. So thank you all for coming and spending some time with us for this.
Thank you, Tiffany and Edith. This was really good. Very helpful.
Yeah, and thank you for all your work in supporting our program. Have a good day.
All right, thank you.
Thanks.
Thank you.